By the time a man reaches the age of 75, his risk of developing prostate cancer is 1 in 7. As he ages, this risk only continues to increase. It is still one of the biggest causes of male cancer deaths in the world due to its prolonged metastatic latency period. Cellular dormancy means clinically detectable metastasis, often to bone, only appears years after initial diagnosis and treatment. The proposed therapy aims to target metastatic colonization driven by angiogenesis. Specifically, our drug will aim to downregulate activity of the therapeutic target, Lysyl oxidase, also known as LOX, a known instigator of the aforementioned hallmarks. LOX is an extracellular copper-dependent enzyme and is crucial to the stabilization of the extracellular matrix, or ECM, due to its ability to cross-link collagen and elastin fibrils. However, with the onset of tumor development, this process is disrupted, and the ECM is altered into a tumor-promoting environment, which is essentially the result of cancer-induced hypoxia. So why does this hypoxia arise? Rapid proliferation of cells, as seen in tumor development, obstructs blood vessels and surrounding tissue, resulting in impaired oxygen flow that compromises essential biological processes. The cancer cells adapt in response, utilizing alternate mechanisms to survive, including the activation of the hypoxia-inducible factor 1 complex, specifically HIF-1 alpha, which is overexpressed in prostate cancer due to androgen-regulated autocrine receptor signaling. Downstream effects aid cell endurance, and one of these mechanisms includes the upregulation of LOX. Unfortunately, elevated expression of LOX alters the ECM into a stiffer environment which facilitates tumor progression for two main reasons. Firstly, stabilization of the ECM is crucial for the attachment of integrin proteins to ECM integrin receptors. These proteins become overexpressed in tumor cells, with LOX-induced stabilization allowing increased binding, which favors stronger cell-to-cell adhesion and more efficient paracrine signaling, ultimately causing unrestrained proliferation and metastatic spread. Secondly, the remodeled environment also promotes direct capillary sprouting under regulation of HIF-1 alpha, which further exacerbates metastatic colonization. Although LOX has been shown to influence both tumor suppression and tumor growth depending on cell location and circumstance, overexpression of LOX has been specifically linked to prostate local invasion. An in vivo study conducted by Nilsson et al. Supports this finding. Tumor cells implanted into an immunocompromised rat subject displayed elevated LOX mRNA expression not only in the prostate, but also in adjacent non-malignant tissue.
Therefore, the proposed treatment will aim to inhibit the action of LOX in order to prevent the metastatic development from the primary prostate cancer by specifically hindering local invasion. Beta-Aminopropionitrile, or BAPN, is an irreversible inhibitor of LOX and is derived from Lathyrus plants. It specifically binds to the enzymatic region of LOX, preventing its ability to catalyze cross-linkage, therefore compromising ECM stability. As early as 1978, BAPN has been clinically tested as a therapeutic agent. Peacock and Madden combated advanced scleroderma, an autoimmune condition characterized by increased synthesis and cross-linkage of collagen, using a low oral dose of BAPN. This deliberately induced a controlled form of letharism, with BAPN breaking down collagen cross-linkage and essentially reversing the effects of scleroderma. Such findings have encouraged recent interest in LOX targeting for metastatic elimination. This is reflected in experimental studies in mice, which have shown BAPN as an effective therapeutic intervention for high-grade breast cancer, in particular the prevention of tumor cell crosstalk with the stromal microenvironment, which is known to facilitate metastasis. It should be noted that BAPN only prevents collagen cross-linkage, so its efficacy is limited against well-established tumors where LOX has already stabilized the ECM. Therefore, the current treatment will focus on the primary prostate cancer in early stages in order to prevent progression to local invasion and metastasis. It also shows promise in treating high-grade castrate-resistant prostate cancer, which is characterized by hypoxia and aberrant expression of LOX, which current androgen-based therapy struggles to defeat. A low, purified dosage of BAPN will be combined with penicillamine, a known copper chelator used to limit extracellular copper, which LOX activity is highly dependent on, and will be delivered via prostatic injection. The delivery method and low dosage will prevent possible side effects of BAPN, as accidental ingestion, especially at high dosages, will result in weakened collagen cross-linkage in the bone and fragility of blood vessels. Like most cancers, the mechanism underlying metastatic spread of prostate cancer still remains widely unknown and thus difficult to treat. So the proposed therapy aims to prevent metastatic spread completely. However, further research for treatments targeting affected bone tissue using BAPN will provide hope for patients already experiencing metastatic spread, granted an appropriate delivery method that will not degrade the bone and surrounding vascular tissue in the process.